Good afternoon, it's Mayor Turner, and I was just wanting to update everyone on the latest coronavirus numbers. As usual, we will go ahead and start with the regional numbers. Amarillo is at 3597. Lubbock is at 1288, and to give you a little bit of an update, Lubbock has been identified by the governor as a crisis point. I'm sure the governor will be sending in the state health people to start looking at Lubbock. Abilene is at 932. San Angelo is at 186. Wichita Falls is at 169. Our sister city Midland is at 322. Currently, we are at 572. We had close to 100 test positive from Friday to Monday. We have 359 confirmed cases, and we have 213 probable cases. As we've talked about last week, the reason they're called probable is because they are using a certain test. It's the test that you get at the place over on Grandview, Singular Care. That type test is only, if it's test positive, you're positive. If you test negative, 20% of those are false negatives. So it has 80% reliability for negatives. So some people that are out there now may have had a false negative, or at least 20 out of 100. So that is a concern. But the biggest concern right now is 572. Last week we had, we gained about 100 cases. We've gained 100 cases in 4 days, which is very concerning. The biggest problem we have right now are those individuals from 20 to 30. That is where we're seeing large numbers. We are seeing large numbers from the bars, bars in Odessa and bars in Midland, and we are seeing that's the greatest increase in numbers we see. Typically, the older individuals from 60 on are doing a fantastic job of staying home and making sure everything is okay. But we are very concerned about that jump. And let me kind of tell you the biggest concern we have. The biggest problem we are going to have as a community is if the hospitals get full. Medical Center right now has 17 patients. They have room for 30 in ICU in the COVID unit. But they have 342 tests pending, which is a huge concern because if some of those come back, they may end up in the hospital. So over at ORMC, they have 8 in their CCU, and they only have room for 15. So if the cases keep going up like they have been going up the last 3 weeks, we are going to run out of just the normal space in the hospitals, which means they will have to go into the surge scenario, which means they will have to increase the amount of beds, of making sure we have enough respirators and things like that. We also, currently in Odessa, we have 3 cases in the Focus Care. We have, those 3 are at Medical Center. We also have 1 from Focus Care of Crane that is in Medical Center. Deering's has 1 case that is an employee, and Sierra Nursing Home has 4 confirmed cases, which are employees. We have 2 patients in ORMC from Alpine, and we have 1 from Monahans or Ward County. So we're starting to see the hospitals get hit more and more, and that is the biggest concern we have, because we have doubled the number of people in the hospital in 1 week. If we double it again, we are in the surge scenario that everybody's been worried about. The biggest problem we have is people not wearing masks. Wearing a mask is one of the best ways to protect yourself from COVID. You see this, Dallas has issued the mask warning, or the required mask San Antonio has also required that. I'm hearing a few more cities are talking about it. And the last thing I want to do is impose anything on our citizens. But if we keep seeing the numbers we are seeing, we are going to have to take a step, because the last thing we want to do is start closing. In fact, I don't want to do it, closing anything or restricting the continual opening. The reason we may have to do something like that is because we have school coming up in, almost 2 months. They are depending upon us to make sure the community is as safe as possible. School, and the kids will be able to go to school at some point. But that's really up to us, because we are the ones out there passing it around. Many of this 100 that got it last week, according to what they are saying from where they go, part of them was a group that went to Austin. Another group went to San Marcos. The governor, I watched his press conference today. He is starting to close the rivers because too many people are out there and too many people are getting sick from being out. They are also telling the TABC to go ahead and close bars where they're not social distancing, or they're holding too many people or taking more in than they should. So I'm going to be in contact with the TABC officers to come here and make sure that our bars are just allowing the numbers that they are. We have had a couple of the big restaurants that have Twin Peaks. They had to shut it down and clean it because too many of them were going in there, and they had some positives. So it is very serious that we take this serious, especially if you have a young person. Sorry about that, my phone blinked. The biggest concern is getting it to a person who has deficient immunity, maybe an older person, maybe a sibling that's sick. That's the biggest concern. I mean, most people are going to be fine with it. But if it gets to a grandmother, or if it gets to somebody like that, it can be very serious. One thing, especially with Lubbock being in crisis and the numbers we are seeing, my concern is Odessa may be one of the crisis. And that's the last thing I want to see, is the governor coming in here, or the government health people coming in and looking at that. So, I told y'all I'd be honest, and that's what I'm being, is honest. But if we don't do something, we are going to have to take a step to make sure things are done. Because we're already, our sister city's at 322, Odessa's at 572. So we could easily be in 600s midweek to late this week. So please pray for our city. Please tell those that aren't wearing their mask to make sure they're wearing a mask, because the last thing we need to do is be on the state's watch list because we are catching so many cases. So I've given you all the information I have. We have changed the leadership group, which holds the press conferences. We were holding them twice a week because our numbers weren't increasing. Now we are going to 3 days a week for press conferences, and I will be on 3 days a week. I will be on Monday, Wednesday, and Friday to get you the numbers that you need to understand where we are. So that's where we are today. So I will keep you informed. I will see you again on Wednesday. So please be careful. Make sure everyone's washing their hands, social distancing, and wearing the mask. And so I thank you very much, and God bless each and every one of you. Thank you.